Hi everyone, welcome to another video. Well, what am I doing here in my tie, my Christmas tie? I only get to wear this for a few days every year. I have finished a long day of work in the hospital. I have some time before dinner, and I wanted to share this video with you while I have my cup of tea. As I've told you before, usually the first thing I do when I get home is make a good cup of tea, either Earl Grey or English breakfast. Put a few Indian spices in it as well. I should share that recipe with you sometime. And enjoy my cup of tea. And hopefully you can enjoy a good cup of tea or coffee as you watch this video. And by the way, if you like this style of video more, which is kind of informal chat over tea, let me know and I'll endeavor to make more of these. So this tie, by the way, before I get onto the very important topic, this tie, this is the days of Christmas represented on the tie. You can see 5 gold rings here, our favorite 5 gold rings. And for the last few years, I'd say, I wear this tie. And the only people who notice it are my favorite patients. They are those little 70, 80, 90-year-old ladies who will comment on the tie and they'll say, Dr. Dhand, I really like that tie. Those are the days of Christmas. And some of them will even start singing it to me. That generation, I'm telling you, they are so cultured. They notice things like that. Whereas my current generation, well, let's not go there. But I really appreciate the fact that I get to work with so many older people. They tell me so many stories and they are going through a low time in their lives. But I work with some remarkably resilient people in the hospital. And despite the fact that they are in hospital, they often maintain high spirits and they're very jovial. But the point of this video is quite a serious topic, and that is how you should do everything possible to avoid coming into the hospital. And I've made some notes here because I want to share this with you. And this is especially important for anyone over the age of 65. Obviously, older people are more prone to hospitalizations with medical conditions in the winter. And there's no hard and fast age cutoff, but we like to use over age 65. And the reason why hospitals are so bad is that despite the best efforts of the staff in hospitals, doctors, nurses, there are a lot of good doctors out there who want to work very hard to improve the well-being and health of their patients and hopefully discharge them. But unfortunately, we work in a subpar system. And a common scenario, especially for an older patient who comes in, is that they will come into hospital, and as they're in hospital, they will get weaker and weaker. They'll get more deconditioned, what I call sinking in bed syndrome. I'll make a video about this soon. They won't get up, they won't move as much as they should. There's not enough physical therapy. Medications are mucked up. Often there's confusion about what medicines people should be on, and patients can't sleep. There's a lot of noise at night. They're getting terrible food. And before you know it, and this is why it's so serious, and I'd like you to think about this carefully, especially if you're over the age of 65 or know anybody else who's over the age of 65. Somebody who is completely well functioning, I see this all the time. They'll come into hospital with like an illness, say a pneumonia, and they get worse. And within a week or two, they are in a rehab facility, and then they never quite regain their full function again. It's awful. Maybe they end up in a nursing home now. This tends to happen more in, say, people in their late 70s, 80s, even older. But it's horrible to see. And I often wonder, well, what happened? Why did their hospitalization end up making them weaker when if we did things right, they could have been discharged fairly quickly and they could have got better and back to their prior baseline. And I don't think that this is a fault of doctors, nurses. Many doctors work very hard to get their patients better. I know I do. Now, obviously, we work in a system which is terrible. As I've said before, I believe many of our doctor leaders are complete and utter lunatics with the wrong priorities. And our system is subpar on so many different levels, and you really don't want to be in a hospital if you can avoid it. Obviously, if you're very sick and have to come in, it's different. But do your best to avoid hospitals, and take it from me, as somebody who's worked in many places. I went through medical school in the UK. I only worked in the NHS for a year or so before coming to the United States to train. And I also did a stint in Australia when I was in medical school. And since being in the US, I've worked up and down the East Coast. I've worked in every type of facility, from big tertiary care centers, academic hospitals, to really small, tiny community hospitals with only 10 or so beds. So I've seen it all. And now, thankfully, I only choose to work in the better hospitals, but these problems are universal. So, what can you do to avoid a hospitalization? And I have some notes here that I want to share with you. And again, I'm not saying that you shouldn't come into hospital when you need it, but you should understand that hospitals are not good places, especially for anyone over the age of 65. So, let's start off first with a very important point, and that is that if you start to feel sick, whatever your symptoms are, whether you feel congested, whether you have stomach complaints, nip any problem in the bud. We all know that famous saying, what is it? A stitch in time saves nine. But I can't tell you how many times I'm speaking to a patient and they'll tell me their story and they'll say, oh, I was sick for a few days and I didn't get help, and then they got worse and worse. And I think to myself, well, had you called your doctor, hopefully you have a good doctor. I know it's a struggle these days to find good primary care, but even go to an urgent care center if you have to. Often something like an antibiotic can be prescribed, or maybe a diuretic if fluid is building up, and it can prevent a hospitalization. So that's the first point I would like to impart, especially again important over the age of 65. In fact, very recently I had a close family member who started to develop some symptoms, and I was all over them. And thankfully, we avoided a hospitalization. But I said, listen, nip this in the bud. I can see it getting worse, and you do not want to end up in the hospital. It's the worst place for you. Okay, what do we have next? Number two, rest. Yes, simple rest. The human body needs rest when it's sick. And I see a lot of people who start to get unwell and they'll keep on trying to run errands. They may go shopping, they may have other things to do. And you can't do that. Now, hopefully, I know this isn't applicable to everyone. Not everybody has good supportive family, but make a loved one run your errands for you. Just totally rest. Let your body recover rather than keep on going through a time when your body is obviously sick. And remember, we could be talking about anything. We could be talking about an infection. We could be talking about another condition like heart failure. Lots of conditions out there, which if you don't act quickly and you keep on going through your regular routine, things can get so bad that you end up in the hospital. So simple common sense, as always. I like to think I'm a common sense person, but rest if you're sick. Let your body recover. Okay, number three, this is super important as well. Stay well hydrated and focus on your nutrition. You might not feel hungry, obviously, when you're sick. On that note, let me go off in a tangent here because I love studies which are common sense. So they did this study once of what is the most useful marker of somebody recovering from an illness. And they were trying to get all detailed and looking at blood markers and investigations. They were trying to find, when do we know when somebody's truly getting better? I believe it was from an infection. And do you know what they found? If I remember correctly, this study was done in Japan. They found it was simply when people regained their appetite again. That's it. And makes sense. Obviously, that's when you know when someone's getting better. But coming back to my point here, when somebody's actually sick, getting worse, very easy to become dehydrated. So please focus on staying well hydrated. Get enough electrolytes, get enough sodium, potassium. By all means, take natural supplements. I'm a huge fan, always have been, of natural supplements, and we can talk about them another time. But whatever it is that you choose to nourish yourself with, make sure that it's pure, and try to eat, obviously, real food. Optimize protein if you can, natural antioxidants. But I do understand that a lot of people, when they're getting sick, they don't feel hungry. But at the very least, please focus on good hydration. Okay, so I mentioned there electrolytes, sodium, potassium. You can take magnesium if you want, but don't become electrolyte depleted. A lot of people do. Okay, Next up, we have be very careful with medications. I've made whole videos on this topic. And goodness me, this scenario plays out so often, particularly people on medicines and especially blood pressure medicines. When people are starting to get sick, usually there's a few days and they continue to take their usual medicines. When often what happens to people as they're getting sick, they're getting dehydrated, they're not eating enough, their blood pressure drops. So think about what happens if your blood pressure is dropping and you continue to take your blood pressure medicine, sometimes two, three, four, 5 pills. That makes everything worse, and blood pressure drops, people get weaker and weaker. When actually, what should have happened, ideally, obviously, you need medical assistance, but people check their blood pressure at home often, and they know that their blood pressure is low. I shouldn't take blood pressure meds. The same goes for other sedative medications, whatever it is you take. Could be a muscle relaxant. Don't get me going on gabapentin. It's one of my worst drugs out there. I see so many problems with it. I see so many people zombified with it, also known as Neurontin. I'm not a fan of it. Maybe it works for you. But people take that in huge doses and then they sort of get more lethargic. Same applies, I may have said, pain medicines as well, or anything that can sedate you. You want to be extra careful when your body is becoming more sick. Often that requires a reduction in dose. Ideally, go through it with your doctor. Okay, number 5 here. Make clear to the emergency room. Often people wind up in the emergency room and they'll do tests on you, and be very assertive. I had a family member in this situation recently. Obviously, if you have to be in hospital because it's super serious, then you have to be admitted. But make it clear to the emergency room. Sometimes they're surprised. The doctor in the ER or A&E in the UK might be surprised when someone says, I just really want to go home. I don't want to be in the hospital. What can you do to give me medicines now? I'll follow up with my primary care doctor tomorrow. I can follow up with whatever other specialist you want. Or I can come back for another test. But what can I do to avoid a hospitalization? That's personally what I would do. I mean, assuming I'm not in a position where I have to come into hospital because I'm almost passing out or something so serious, I would do everything possible to persuade the emergency room doctor. And I've seen that happen. I've seen a lot of people out there in the ER sort of say, look, I don't want to come in. What can I do? My family will take care of me at home. We'll watch very carefully. Just don't come into hospital. Because once you're in hospital, you're truly plugged into the system. And again, don't get me wrong, I'm proud to be a hospital medicine doctor. I think we do some great things with reversing illnesses, but I would far rather that people didn't get sick. And when they are in hospital, I personally want to discharge them quickly because I know what's going to happen. As I mentioned, you won't be able to sleep, you'll get terrible food, you won't move around enough, you'll get weak, more deconditioned, you'll be prone to picking up more infections. And before you know it, a 76-year-old who was very functional ends up in a rehab and they're never the same again. It's horrible, but a hospitalization can do that. I don't want to scare you. And again, I don't think that most doctors out there want this to happen, but it happens absolutely everywhere in every single country. So be very careful. Now is winter season. More people are getting sick. And don't be a statistic. Defy the odds and avoid interactions with medicine unless you absolutely have to. That's my whole philosophy. I think that doctors are there. That's why I went to medical school. Doctors are there to help people when they get sick. My vision of being a doctor was, okay, you're sick. I get you better. Bye-bye. But the whole mantra has changed. We have a disgraceful system right now. We have disgraceful leadership. Our paradigm is completely broken, where now it's all about getting people on medicines and injections for life. That to me is not what being a doctor is all about. I want people to get better, wave goodbye, and ideally not be on any medicines, only be on natural things, do everything naturally, look at what you're eating, etc. Be very lifestyle oriented. Of course, that's what most of my videos are about. Hospitals and healthcare should only be there for when you absolutely need it. And even then, it's a temporary thing. I like de-prescribing medicines. I like getting people off medicines. Frequently when they come into hospital, I de-escalate things and I realize that they don't need it and they're very happy and their family is happy, and then they can follow up with their primary care doctors and take it from there. But please don't be a statistic, because our medical establishment is an absolute disgrace. Many segments of it view you as a number, a statistic, a conveyor belt, somebody who's there to bill and make money off. And don't be a statistic. Be wise to the ways of the world, but understand that if and when you do get sick or a loved one gets sick, that there are a lot of people in healthcare who are very devoted to getting you better, but we work in an absolutely terrible system, and this is fairly universal. So, everybody, be well. Let me have one more cup of my tea. Sorry, did I say cup of my tea? Let me have one more sip of my tea. And hope you all have a good rest of the evening. So if you liked this video, you know what to do. Please like the video, subscribe, share with anyone who may benefit. Feel free to check out my other work in the links down below. Check out the description down below. Look at my website. And I hope to see you all again very soon. Dinner's ready imminently. Take care, everyone.